Erez, thank you for doing this today.
Thank you
This is
so
great.
much. Thank you for having me.
So tell us what you're going to do today.
Well, we're very excited. I think arms, for me personally, are one of my favorite areas to do with radiofrequency. As we know, arm lifts or brachioplasty tend to be an undesirable procedure for patients because of the long incision and downtime. So radiofrequency has really been a great solution for us.
Kind of like a gap procedure, like in
Exactly.
betweener.
And this is a perfect patient, a patient in their 50s that has some laxity that bothers them in the upper arm, but is not severe enough to have an excisional procedure, and liposuction is also going to leave some loose skin. So this really addresses that gap group. Very popular area. So we're going to do above the knee. We're going to use BodyTite in the arms. We're going to use FaceTite for the upper knee area, and then we're going to use Morpheus Body, which has really been a very successful fractional radiofrequency device to additively include radiofrequency.
Right.
So just to describe the tumescent technique, so the solution A basically is 1 gram per liter, and that really works exceptionally well. And I think one of the key things I learned from Dr. Chia and Theodoro was how you really want to tumescent is to go right above the fascia level and treat the nerve like a tree and get to the root first, and then all the branches will go numb. So we use a solution A, and this is a great illustration of that. So the first thing we do is take a few cc's of just 1% lidocaine with epinephrine just to create a wheal. And I think one of the nuances I've learned is to really go perpendicular to the skin. You don't want to create a wheal in the dermis because it tends to be a little more painful. So we create a wheal at our entry point. We make a small access incision with an 11 blade. And then we use the spinal needle or tumescent cannula, and we go deep first. And if you go deep first, it does a few things. The first thing is it opens up a natural plane, because the suprafascial plane is where you want to be. That's where you're going to maximally heat the fibroseptal networks. So the overlying goal of this technology is to apply radiofrequency energy to the fibroseptal networks. So if you tumescent above the fascia, we're really opening up that plane. It functions as a heat sink. Of course, it's an anesthetic, and it's going to work best from deep to superficial. I treat radiofrequency almost like an iron, and the way it's positioned matters, especially over curved areas. So I like to cantilever down. What really matters from a safety standpoint is the internal electrode. That's where the energy is coming from. So you don't want to ever really see your internal electrode superficially. Like when people do high definition liposuction cases, they want to see their cannula. Right. You don't want to see the internal electrode. That needs to be deep. And it's important when you're coming over curved areas to maintain this cantilevering down. So that's a very important feature. And the second thing is you want to avoid the entry port by about 1 centimeter in a case like this, because if you don't, you're always going to heat that area. It's going to be overheated, because every pass you take, you're going to overheat that single area.
Can you show them where you put the entry port?
Yep, so the entry port's right here. It's a very small, just 11 blade access point. And then we just treat row by row very systematically. And I think, for the surgeons that do a lot of liposuction, this is kind of a very different way of doing things. With liposuction, you're moving fast and you're cross-hatching, trying not to cause a contour deformity. With these cases, you have to look at it more like ironing. You want to do row by row, being very systematic to hit your target temperatures, and make sure that you treat the whole area. So we like to do it in a retrograde motion first. So, as you noticed, I kind of pass the device to make sure I have a clear runway here, because I want to make sure that I have, that there's nothing kind of obstructing me. Now, she's never had
pre-tunneling.
Pre-tunneling, exactly. Yeah. And sometimes it's nice to do it with the tumescent cannula. It's a little bit more rigid. So the single beep means we're far away from target temperature. You're going to hear a double beep next, which means we're approaching. And then you're going to hear 2 types of triple beeps. The fast triple beep means we've hit internal target temperature, which is really our main goal. And then there's a slower triple beep, which means we've hit external target temperature. So I'm just slowly treating, cantilevering down. I'm moving. I don't like to stay in one place for too long. Now this heat is going to stay in the tissue, so we actually do not recommend putting ice on it. We want that heat to stay in because it leaves an effect. So you can see, now the nice thing about this device is it's not continuously firing, it's maintaining that temperature. So I'm not worried about overheating it. As long as my depth is appropriate, I don't want to be here forever, but I'm at target temperature for, 20, 30 seconds, and that's great. The way I like to do lipo, so I'm just going to clean some of this gel off here. And again, it's a 270, so I'm just going to insert the cannula. I like to stay deep, and I just kind of pinch the skin I like to stay deep here because I don't want to cause any contour issues. And she doesn't have a particularly large arm, so I'm just kind of fanning out, debulking, and kind of trying to focus here a little bit on some of the areas of a little fullness more proximally.